Dissociative identity disorder is oftentimes seen in movies like Split, Fight Club, Girl Interrupted. When talked about, DID is more widely known as personality disorder. Even when you watch the news or watch TV, it's commonly attributed with negative ideas about the disorder. As a psychology major, I find mental disorders interesting and wanted to share with you some information I've learned from the last few years I've studied. I will go into detail about dissociative identity disorder, what it is, how it's treated, and common misconceptions. What is dissociative identity disorder? It is a mental disorder that people have when they try to block out childhood memories that were traumatizing to them. One of the common traits that people usually have when they have this disorder is two or more distinct identities and gaps in the memory around childhood and everyday activities. It is not to be confused with people who black out because of alcohol or any substance abuse. It develops because of the traumatic events when they were younger, and it's used as a coping mechanism so they don't have to deal with the trauma. Day to day is a strain to their social and professional life, and it could lead to substance abuse. People with DID also tend to suffer from depression or have manic episodes. Treatments for DID tends to be psychotherapy, family therapy. Most common is psychotherapy, and it's when they try to identify what the trauma was in the person and get the different identities to form into one person instead of having separate identities and people have memory loss and things like that. Family therapy, it mostly benefits the family because they get an understanding of the disease and how to help their loved ones. But for the patient, it could hinder their development because the trauma could be from that person they just do not remember. And there's always a risk of relapse when there's a lot of stress in that person's life, and if they abuse alcohol or any other drugs, or when they relapse, they can turn to drugs or alcohol. 3 misconceptions for dissociative identity disorder is that it's a trend, it's overdiagnosed, and it's a medicinal treatment. Well, it's caused by a medicinal treatment. People believe that it was a trend because psychologists at the time believed that it was not a real condition. In reality, it is prevalent today and still highly researched. Also, a myth is that it's overdiagnosed. In reality, it's underdiagnosed and undertreated because lack of trained lack of trained psychologists are able to identify the disorder, and often people do not seek help when needing when having dissociative identity disorder. Also, another myth is that it's caused by medicinal treatment, meaning from medicines that they receive from their doctors, but it is proven that it's caused by trauma. And since media portrays DID in a certain way, even psychologists fall prey to that idea. Overall, dissociative identity disorder is a real disorder and it affects numerous people throughout the world. People with traumatic childhoods tend to be affected by DID more often and is used as a defense mechanism to protect themselves against their unwanted memories. The best way for them to be productive in their day-to-day life is to seek help. I hope you take away. I hope the takeaway from this is that you have a better understanding of dissociative identity disorder, and not to make any assumptions on any mental conditions. And that's all.